The hospitals and care homes, of course, are seen as the front line in the fight against COVID-19. But there's also a bit of a home front as well. District nurses and other support workers are playing a vital role in helping patients after they've been discharged, but of course still need care. Quentin Rayner reports.
Between them, Katie and Michelle have over 30 years' experience working in community health services. As a district nurse and physiotherapist, they often work together. Both strive to help people get better at home and prevent them going into hospital unnecessarily. Some patients are recovering from COVID-19, and the pandemic has affected how they go about their jobs.
If we're supporting patients at end of life, even relatives, that fact we can't touch the relative or support the relative and we're having to be at a distance has had a real impact really. Wearing PPE, we're missing our smiles, you're missing our patients that are hard of hearing. It's very difficult then to communicate with those patients.
Since COVID, we haven't had a massively increased demand in our work, but we're finding that the patients are more complex. They're coming out weaker and they're needing more time really to help get them stronger and regain their skills. So the visits take longer and we're taking longer to be with them to help them recover.
Katie cares for up to 6 patients a day and on each visit changes into PPE. As a district nurse, how protected do you feel in terms of PPE?
We've been supplied well with PPE from the Trust. We haven't run short and there's constant supplies being ordered weekly. Overall, generally feel quite well protected at the moment.
And their work is easing pressure elsewhere in the NHS.
Our district nurses need a huge amount of recognition for the work that they're currently doing. They're keeping patients out of hospital, but they're also taking patients much earlier from hospital.
If and when a vaccine becomes available, district nurses will be in the vanguard of protecting some of the most vulnerable. Quentin Rayner, BBC East Midlands Today, Bingham.